All right, pharmacist interventions part 7. 7 is my favorite number. So this interaction flags often. It involves the drug codeine, which is an opioid. It metabolizes into a more potent metabolite being morphine via CYP2D6, which is a liver enzyme. So a few medications block that metabolism. They're called 2D6 inhibitors. We have Prozac, Paxil, and Wellbutrin being the main ones that cause this. So the other day I did have a Prozac and codeine interaction. A lot of opioids, like morphine analogs like hydrocodone, use the same pathway. So hydrocodone metabolizes into hydromorphone, and oxycodone metabolizes into oxymorphone, which are more potent metabolites. So I told this patient, hey, your pain might not be controlled as well as you'd like it to be, given that you're on an enzyme inhibitor. So I try to explain that in layman's terms with them. Another interaction that I had was a few weeks ago. I had someone prescribed the 50,000 international units dose of vitamin D. Instead of it being a weekly for short-term or even a monthly dose, the patient was given that and prescribed it daily. So they're picking up 30 of them, and it was prescribed every day. I think there are a few refills on that too. So I intervened and told them, hey, this shouldn't be taken every day at all. It's either weekly for a little bit of time and then monthly, depending on what your vitamin D levels are. So too much vitamin D can cause hypercalcemia because vitamin D is used, or also in nature increases how much calcium you absorb from your gut, and then it also decreases how much your kidneys excrete. So it can cause ataxia, which is like an abnormal gait. It can cause polydipsia, which is like excessive thirst. It can cause arrhythmias and kidney failure at the absolute worst. I don't usually see vitamin D toxicity very commonly, but this is something I intervened on. Told her to follow up with their doctor and see what regimen they're supposed to be on depending on what the vitamin D levels were. Another intervention that I made was yesterday. I had a patient who's 16 years old. She was prescribed an EpiPen at a dose that was too low for her. So she was given the 0.15 milligram auto-injector, which is for patients who weigh between 33 and 63 pounds. I call it low-dose Epi. There is an available dose of 0.1 milligrams with the AVQ auto-injector for like infants, patients less than 33 pounds. But this patient was supposed to be given the 0.3 milligram EpiPen. And I noticed in her history she's been picking up the 0.15 dose every now and then within the last year or so, maybe to have like extra on hand at school, or maybe it expired, she threw it away, she needed a backup. So it was the same provider sending them in. So I just wanted to clarify that they're sending in the right one, because most 16-year-olds are probably more than 65 or 66 pounds. So yeah.